So your relative or loved one is non-verbal. They cannot tell you how they feel, what is happening, and you are wondering, how can I be sure that my loved one is being cared for and that any incidences or so at the nursing home or the caregiver will be told to you. One, look for facial expressions. You know your loved ones more than your caregivers and the nursing home. So whether she's at the nursing home or at home, ask questions and look for the facial expressions. Look at the body language. Does it look like the patient, like your resident, is in pain? Does it look as though they're comfortable? Do they look as though they're uncomfortable? Do they look as if they might be thirsty? Look for gestures as well. So their eyes may move from one thing to the next, trying to indicate to you what they're probably trying to say. The hand may come up a little bit, and they try to indicate something to you. So you're looking for those things that are very important that says to you, okay, everything is okay, or there are issues. Visit the nursing home at meal times and look at the facial expression and learn to recognize whether they're enjoying the meal or not. So those are some of the things that you can do. You can do calls, video calls, so that even though they are not speaking, they are hearing you. And sometimes they find a way to communicate, or sometimes you find a way to communicate. But you need to have frequent calls and video chats and visits to the nursing home to them, so that they are able to rest assured that you are still around, you have not abandoned them. You establish a routine, exactly, right? So you establish a routine, okay, ever so often you come to the nursing home at so-and-so time, you do X at so-and-so time when you come, so they begin to recognize that. If they are the nursing home, or even if there's a caregiver at home, you can request from them that they turn your relative, so that you can see for yourself whether there's any breakage in the skin, whether there's any bed sore forming, whether there's any redness, there's any itching, any bruise, and you are able to ascertain that, okay, there's none. You feel more comfortable doing that, and it is your right to do that. You can ask the nursing home owner or the nurse, prearrange it. I would like to see my mom at so and so time, and can I please have a look at her back, the coccyx area, and so forth. You also need to develop a good relationship with the staff at the nursing home. They begin to understand you, you begin to understand them, and they feel more comfortable approaching you with issues. Pay attention to the attitude of the nurses. See how they are speaking to other residents. So, and if you have any issues with how that is being done, you are again free to pick it up with the nursing home owner or the nurse manager, so that they can address those things, because those little things tend to make you feel very uncomfortable, and you begin to imagine all sorts of issues taking place, when a nice discussion with your nursing home owner or your nurse manager would quell that and would reassure you that everything is okay. Look at how your relative is dressed. Have they dressed them properly? Look at the nails. If I go to a nursing home and my relative is dressed in a nightgown or pajama in the middle of the day, I will have some issues. So you want to make sure that your relative is well dressed. Look at the nails. Make sure the nails are short. If it isn't, you can ask them, nurse, can I have her nails clipped, please? One more thing, your relative should have a doctor's visit at least every 6 months. Ministry of Health dictates that. And of course, common sense dictates that, so that you are able to catch any issues before it gets worse. Your doctor will do a host of stuff. They will check their cognitive status. They will check their blood pressure status. They will check their their blood sugar status. They will check the skin. They will do bloods as well. They may do bloods as well. They may do many medical things that are required to ensure that your loved one is well taken care of, and we are ahead of the curve, because we are doing preventative management rather than waiting till they get ill and then calling in your doctor. Don't be afraid to step on toes and ask for what you would like your relative to have. However, do it in a manner where you are a team player with the team of nurses at the nursing home or with your caregiver at home, so that you can have that sort of relationship. But if it comes down to it, it is your right to demand and to insist on par excellent nursing care for your relative.